Welcome to Dr. Baliga's podcast for the Kurious Doc. Today is May 29, 2026. This video is on a JAMA article published online yesterday, May 28, 2026, titled Adverse Effects and Treatment Discontinuation of Blood Pressure Lowering Drugs and Combinations, a Network Meta-Analysis. There is an accompanying editorial comment titled Minimizing Adverse Effects in Hypertension Treatment. Adverse effects contribute to undertreatment and poor blood pressure control. A network meta-analysis of major antihypertensive classes and combinations was conducted. 716 double-blind randomized trials. Study cohort comprised of 159,362 individuals. Mean follow-up 8.6 plus or minus 5 weeks. Mean age 54.6 years. 44% were women. Baseline blood pressure 158 by 100 millimeters of mercury. Databases searched through December 31, 2024. A fixed effect Bayesian network meta-analysis was conducted. Odds ratio with 95% credible intervals. What did they find? Calcium channel blockers odds ratio 1.43. Risk difference plus 1.2%. ACE inhibitors plus calcium channel blockers odds ratio 1.46, risk difference plus 1.1%. Beta blockers plus thiazides, odds ratio 1.58, risk difference plus 1.7%. Angiotensin receptor blocker, odds ratio 0.73, risk difference minus 0.8%. Angiotensin receptor blocker, ARBs plus calcium channel blocker, odds ratio 0.61, risk difference minus 1.2%. All regimens increase dizziness. All except calcium channel blockers reduce headache. Best tolerated combinations: ARB plus calcium channel blockers, ARBs plus beta blockers, and ARB monotherapy. Limitations: trial level data only, short term follow up, network analysis assumptions may not apply to individual patients. Key takeaway: ARB-containing regimens had the best tolerability. Combination therapy can be better tolerated than monotherapy. Calcium channel blockers containing regimens had the highest withdrawal risk. Editorial cautions: the accompanying editorial said that blood pressure control remains poor despite major cardiovascular benefits. Medication adherence is strongly influenced by adverse effects. Tolerability should not outweigh proven outcome benefits in specific populations. ARBs may outperform ACE inhibitors partly because of lower cough rates. Calcium channel blocker related edema may contribute to higher discontinuation rates. Cardiovascular outcome benefits were not assessed in this meta-analysis. Generalizability to underrepresented populations is uncertain, and the follow-up was only 4 to 26 weeks. Long-term tolerability may differ. Clinicians should balance efficacy, adverse effects, and patient-specific indications. Clinical pearls: ARB plus calcium channel blocker ranked highest for overall tolerability. Four of the top 5 regimens contain an ARB. Dizziness increased with all blood pressure lowering regimens, especially combinations. Most regimens reduce headache frequency despite headache often being listed as an adverse effect. Calcium channel blockers increase edema risk substantially. ACE inhibitors markedly increase cough risk. Combining ARBs with calcium channel blockers may mitigate some adverse effects while improving tolerability. Withdrawal due to adverse events is a clinically meaningful endpoint because it predicts adherence. Better tolerability may translate into improved long-term blood pressure control. This is an infographic. Hit pause and read at your leisure. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.